My name is Dr. Styer, and I'm the medical director here at CCRM Boston, and I'm a fertility physician. And I want to welcome everyone to this evening's Spring Fertility Reset, really understanding which diets and eating patterns can really optimize fertility and path to parenthood. Today, I'm really excited to have special guests. We've done this about 6 months ago. One of my really dear and trusted colleagues, Jennifer Redmond. She's a fellow board member of mine. We're involved in New England, but also Jennifer is a certified integrated nutrition health coach who has worked in fertility field for more than 15 years. In her Empowered Fertility program, Jennifer has taken a 360-degree view of her clients' wellness and helped them implement customary dietary and lifestyle changes to boost fertility naturally and feel deeply supported in the process. And so we're really grateful to have Jennifer here to really talk about which diets can optimize your wellness and path to pregnancy. And so thanks so much for joining us tonight, Jennifer, and participating in this great program.
Yeah, I'm so happy to be here. It's such a great topic, and I'm so happy to collaborate with you on this. It's such great information for your patients, and I know you get a lot of questions about this, so I'm happy to help sort of dispel some of the myths and share some of the truths.
Thank you so much. And as a point of background, those who are here, Jennifer and I known each other for several years when we first opened, and CCRM several years ago. And we shared so many patients, so many success stories, folks who really wanted to see what they could do for themselves. The most common question is, how can I help myself during this process outside the medications and the other aspects of fertility? And Jennifer has been incredible in terms of, really empowering folks to understand nutrition, understand just really what they can do from a dietary and other wellness standpoint to really improve things. And here at CCRM, we really do take pride in individualized care, whether it be the medical, but also holistic side. So again, it's been a great opportunity to work with Jennifer and to really see the results. So tonight, what we're going to do is I'll first go through a very brief overview of infertility. And after that, we'll start talking about, the several aspects of general nutrition, goals of nutrition, and consultation for nutrition. Then I'll have Jennifer go through the different dietary options as well as behavioral and dietary patterns. So let me get into my slide where I'll share my screen here. Here we go, share screen, and then I'll get into my presentation. And let me know if you can see the whole screen. Can you see the whole screen now?
Yep.
Okay, perfect. So again, welcome everyone to 2021 Fertility Spring Reset. We did one in January. It was really, really popular, and a lot of folks walked away with a lot of great information. We want to take it to another level, though. We talked about just basic things when it came to, general infertility or women who have PCOS. But now I want to take a different level to really look at those diets and those interventions with diets that can really hopefully change your course. So tonight we'll do a quick fertility review. We'll do an overview of nutrition. We'll talk about how nutrition and fertility care can be synergistic. That's really what we're all about here, is to really understand the synergy and the collaboration that we can bring about with both our disciplines. And then finally, we'll go over the different diets and eating patterns as well. So just a quick overview. We know that about 15% of all couples will have infertility in a lifetime. And about a fifth of those, are typically unexplained. They have normal testing. But we know that wellness and really optimizing nutrition has really been correlated to longevity, but also improving fertility potential, also improving IVF outcomes as well. There's many studies that are emerging looking at the synergy of diet and fertility in both men and women. I think many of us focus on the female side, but we know that also nutritional status can impact male infertility, but also semen parameters and its general wellness in both sexes. Now, looking at what causes infertility, again, I think there's a disproportionate burden placed on women, which is completely unfair and unjust and unequal. And we see that about a third of cases are due to men, a third of cases are due to female factors, but then the other third is due to both male and female factors or unexplained infertility. So it gives you an understanding of really of the fact that there's equal distribution between men and women for causes of infertility, and also that there's some causes that are unexplained where they have normal testing. So just to give you some background on kind of what we find when we see patients who come to see us for this issue. And then from the female standpoint, one thing that everybody focuses on is egg count. We know that women are born with about 1 million eggs, and we know that number declines with age. There is no more eggs that will be created during a woman's lifetime. The number only declines. And peak fertility is actually between 24 to 28 years of age, with a very slow decline in fertility and number of eggs as women get to the early 30s and the late 30s. Now, one issue here is really thinking about, well, what do we at CCRM, what does Jennifer Redmond think about in terms of fertility care? And it really comes down to the individual. You're not a number, you're not somebody you can put into some recipe. One size does not fit all. Every couple and every patient is unique. Different hormone levels, different medical histories, different places you come from in terms of, educational, socioeconomic status, different ideas of how dietary principles should be practiced, different exercise regimens. So it's really going to be important when you go to see your fertility provider to understand, look, we're looking at you in all aspects and really trying to come up with a customized program to help you. Wellness nutrition is the foundation of success. Really interactive care. We want to listen to what you have to say, listen to your issues, listen to your concerns and questions. And I think ultimately it's a team approach. Not one of us can really help you by ourselves. So I look at myself as a physician who's done this for 20 years. I look at my nursing staff, our medical assistants, our financial coordinators, our nutrition colleagues, such as Jennifer Redmond, our acupuncture and holistic and herbalists, and other mental health providers who provide other sides or aspects of care that we can't provide. So I think it's a team approach to really help you be the best you can be when trying to conceive. And one thing to take home here is really basic things in terms of lifestyle and daily habits. Weight is something we all focus on. So body mass index, something between 19 and 26 milligrams per kilogram. So it's your height divided by your weight squared. We know that extreme weights or BMIs can adversely impact egg quality. It's even seen in people who are using egg donors. So someone who else is going to donate eggs, we see that impacts them as well. So that weight and the amount of lean muscle really does impact egg quality as well as fertility outcomes. Also, the risk of pregnancy loss and stillbirth as well are increased when your body mass index is over 30. And we know that for a fact that with increased body mass index, the success rates of IVF declines. You have to do more IVF cycles to be successful when your body mass index is over 35. And finally, which is fairly self-explanatory, but some folks don't really think about it, is habits. Tobacco use and even things like vaping have been correlated with reduced egg reserve. Really very limited use of alcohol or occasionally social use of alcohol doesn't really have an impact on fertility, but the calories and the carbohydrates, if you have a lot of drinking or increase or excessive amount of alcohol, can affect it. And there's variable results of caffeine studies as well, so it's hard to know. But we always say at least 1 cup of coffee a day probably doesn't have an impact. But if you're really trying to optimize everything, sometimes folks will just go without that. And Jennifer will get into that as well later on. And then finally, exercise, a really common question I get. Balancing exercise, aerobic and weight bearing, typically less than 20 miles per week is what we see in the traditional studies that is healthy. Appropriate hydration, your cells are made mainly of water, so really hydration of high quality fluids, electrolyte rich fluids, appropriate calorie intake, appropriate recovery after working out is important. Irregular absent periods may be the sign that there's too much exercise or that your nutrition is not balanced. So something to think about. Your body's going to always tell you, if you need to do things differently. And I think finally, leading into speaking with Jennifer and getting Jennifer's insight tonight, really nutrition. I think foundational wellness is what we know. It's a pillar really of conception and pregnancy success. And there are a lot of complex and variable diets that we'll have Jennifer, discuss with us tonight that we see here. So with that, Jennifer, I just want to kind of dive into the first topic, is to kind of have you really provide for us really what are your general principles surrounding diet nutrition? What do you talk about in the initial consultation about what you think are the pillars and foundation of really understanding nutrition and dietary optimization?
Yeah, so thanks, Dr. Styer. I really I appreciate that overview of fertility and infertility, and like you, I really take an individualized approach. approach. Every body is different. We're going to talk about specific diets, but not one diet is right for everybody. And, kind of quote unquote diets in the traditional sense really don't work. So this is more, to your point earlier, about eating in a way that supports your body and your fertility. So some of it is listening to your body and hearing what it's telling you. But some of these general, overriding principles are, I always like to say, eat the rainbow, eat fruits and vegetables in a variety of colors for a variety of nutrients. Choose organic wherever possible. You need to think about the fact that pesticides are toxins. And studies have shown that women with the highest toxic load from pesticides have lower chances of pregnancy with IVF. So that really goes to show you the importance of, eliminating some of those toxins from your diet. Eating healthy sources of protein, that's going to look different for different people depending on your makeup and how you eat. So, if you do eat meat, healthy sources of protein look like things like pasture raised and organic chicken, pasture raised and organic beef. You're looking for animal protein that's not treated with hormones and those hormone disrupting additives and antibiotics. Preferably your healthy sources of protein are more plant-based than animal-based. And then, for many people, it's about eating gluten-free grains and carbs. And I'm talking about gluten sensitivity, not celiac disease, but gluten itself is highly inflammatory. So those are some just overriding principles.
That's great. And when you sit down and talk about what are the actual goals after talking about the principles, goals in nutrition for infertility, what kind of endpoints are you trying to improve in somebody that sees you for a consultation?
Sure, absolutely. So I think the thing is to remember that, gut health is linked to all health. And I think that's why that term gut health is sort of gaining more popularity. People are realizing the impact of that on overall health. But I think the main things are, reducing inflammation. Inflammation is really the precursor to just about every disease. It's about increasing nutrients. So trying to think about the food on your plate as sort of that primary or first line of nutrition rather than relying on supplements to get certain nutrients. Some supplements do have a role, but if you can really think about how can you get those from the original source, right? Eliminating toxins, which you mentioned, disrupts hormones, also disrupts blood sugar and can cause insulin resistance. And then we want to look at improving egg quality. To your point, the eggs are such an important part of the equation, right? One egg takes 3 months to mature before ovulation. So there is time to work on egg quality. And then, you can balance blood sugar and insulin levels often by addressing lifestyle and nutrition. Your body has this amazing ability to heal itself by itself. So that's a pretty general and bold statement, but in many cases, it's the truth.
Yeah. So couple of questions that I get from a lot of patients, and also I see a lot of Google searches on this. One patient came to me with a bunch of Google searches the other day. Is the impact of carb intake in fertility. They asked me, should we go carb free? And I said, everything's good in moderation. Give me your sense of and we can get into the diets later on, just your general kind of gestalt about carbohydrates.
Yeah, so I love that you just said everything in moderation. I think that the biggest thing with carbs is choosing the right carbs and not having a really carb heavy diet. So if you can sort of moderate the amount of carbs along with increasing protein at the same time. So sort of maybe if you eat a real carb heavy diet, stepping back on that a little bit, increasing protein, and that can do a lot for balancing blood sugar and insulin levels.
Great, that's perfect. And there's other inflammatory disorders that we see with infertility tracks with, such as endometriosis, such as uterine fibroids, adenomyosis, recurrent pregnancy loss. Is there anything more that you advise patients who see you have those things in addition to infertility that they should be doing or thinking about?
Yeah, so I think really thinking about, when we talk about a quote unquote fertility diet, right? One of the major goals is to reduce inflammation, which can
Yeah,
be linked to all those things that you just mentioned. So I think really looking at the individual and thinking, what are the inflammatory foods in their diets that we can take out and replace with more fertility boosting, health giving foods.
that's perfect. Well, thanks so much, Jen, for that overview of just goals and principles of nutrition. So now we want to get into the actual diets. I think it's something everybody
Okay.
wants to learn more about. So I'm going to flip back to my screen here, and I kind of a summary slide, and I'll have you kind of review these with us.
Yep.
Because we do this all the time, and I love to learn more from. Let me get back into my screen here. Can you see the full screen here?
Yep.
Okay, so let me get to the next one. So we'll talk tonight about, diet eating patterns, including the Mediterranean, the paleo, keto, vegan, and intermittent fasting, which is the eating pattern. And so first off, we'll talk about Mediterranean. It's probably one of the more well-known here. And I know that it's based upon traditional foods in Italy and Greece in the 1960s. And there are some, age-matched long-term observational studies looking at, risk of heart disease and stroke, and they're reduced with this. Give us a sense of your, understanding and background of this diet, Jennifer, the pros and cons, who would benefit most from this, who should not utilize this, for the
Right.
audience here.
Okay, good. Yeah. I didn't know you were going to do all this research. That's awesome. So, um, so really, while I say that there's no one diet that's right for everybody, and there isn't, the Mediterranean style diet is really one of the best ways to eat to support fertility.
Yeah.
So the way that this type of eating is that it's less red meat. It's more protein from seafood and plants. It's lots of vegetables, a moderate amount of fruits, whole grains, and
Mhm.
healthy fats. Studies have definitely shown that women eating this type of diet had better chances of pregnancy and a healthy live birth. It's generally really the best way of eating for most people. Now,
Okay.
granted, the Mediterranean diet does promote moderate use of dairy. Dairy isn't right for everyone. Again, that goes
Mhm.
back to the bio-individuality.
Yeah. Okay, great. And you talked about healthy fats. What's the most common fat source in this diet?
A couple of them. Definitely olive oil,
Yeah.
definitely avocado,
Okay.
and nuts are a really good source of healthy fats.
Now, one quick question I have a lot of patients who complain about the side effects of dairy because obviously I'm guessing yogurt's a principal part of this whole thing.
Mhm.
What's your sense of the risk of any kind of reactions with yogurt and inflammation in this diet?
Yeah, so interestingly, I'd say about from what I've read, about 50% of people actually have issues with dairy.
Mhm.
Um, most people, some people, if they find that cow's dairy, a traditional yogurt is a problem for them or milk. Sometimes goat products are better. But what
Okay.
you can do is really, pull out the dairy from your diet for a few days and then add it back in and really tune into how your body's feeling. And that's going to give you a lot of good information. I will say that if dairy agrees with you, and you are going to continue to eat it, to eat full fat dairy. The benefits of that in some studies around women's health and fertility, full fat is much better than low fat or non-fat.
So I get the impression, Jennifer, thanks for that, is that this diet can be utilized by a large variety of infertility patients. Is that correct?
Mhm. Absolutely.
Okay. And one other thing I noticed too is there are many different approaches in this diet. It's not like other ones where there's specific things you can eat. This
Yes.
one, it seems like there's more of a diversity and more choices.
Yep. Yep. I would agree with that. Yeah. And, I think, again, the biggest tenets are, more of your proteins from like fresh wild fish, uh, plant-based sources, less red meat, and really it's about whole unpackaged foods. So if you can think about just those fresh whole foods in their original forms, this time of year here in New England, it's getting easier and easier to do. So
Yeah. No,
yeah,
I
it's
get
a
it.
really versatile diet.
That's great. Thank you so much for that great summary. Now
Yeah.
let's go to the next one, which is paleo, which is Paleolithic or AKA paleo.
Yep.
So people call it the caveman. You see, I put the Flintstones on the side. Those of us who are old enough to remember the Flintstones. I used to hate watching that show when I was younger. And they've made several different iterations. I've seen the movies, recently. But I think it's pretty much we're trying to really mimic how we ate when we were essentially hunter and gatherers.
Yep.
Can you walk us through this diet option?
Yeah, absolutely. So, yeah, absolutely right. It's sort of the idea is that like our Paleolithic ancestors, can teach us how to eat. So I think, one of the good things about the paleo diet is that it's really about whole foods as opposed to
Yeah,
processed foods.
gotcha.
And one of the biggest tenets of paleo is that it eliminates gluten, it
Mm,
eliminates dairy, it eliminates sugar, whole grains, and soy. And so what you're left with eating, a lot of things, but animal protein, vegetables that are non-starchy, fruits, nuts, seeds,
mm,
herbs, and some oils.
okay.
Um, and so I think the pros are, like I said, you're eating whole foods, you're eating vegetables, seeds, and nuts, but it's pretty restrictive.
Mhm.
There's no grains, there's no dairy. You definitely can get fiber from veggies, and you do get a lot of fiber from veggies.
Yeah.
But grains, whole grains like brown rice and quinoa, um, help your body eliminate excess estrogen, the fiber in those.
Yes.
And so it's not ideal for everyone. I mean, like I said earlier, the literature is kind of mixed on dairy.
Mhm.
Um, but the absence of the grains and legumes, which are considered really good sources of fiber and vitamins and other nutrients, could be concern. As far as benefits for any specific group, when it comes to infertility, there really haven't been any long-term clinical studies on it.
Okay. That's good to know. And one thing I learned when I was looking at this is that there's some lifestyle components focused on wellness exercise. Can you walk us through what that means for the audience?
Um, with paleo specifically, I mean, I think if you sort of think about the hunter-gatherer
Yeah.
diet, I'm not sure specifically when it comes to paleo, but that's what it brings to mind. And, sort of getting, um, in my mind, it makes me think of like getting out in nature,
Mhm.
a lot of movement, that sort of hunter-gatherer, out there doing all the things. So, I mean, I think that piece of any, if that's a component of any diet, I wholeheartedly support that
Yeah.
because movement, exercise is a huge part of wellness.
Now, when we talk about processed foods, like, can you give example of really no-nos for processed food that even if you're not on paleo, you want to avoid?
Yeah. So for starters, even though I've found that for most people who are trying to conceive, giving up gluten at least for a period of time can be really beneficial. Avoid the gluten-free aisle of your grocery store. If you pick up a box of crackers that's gluten-free, or you pick up a box of cereal that's gluten-free, read the ingredient list. I guarantee you're not going to know what most of the things are that are in it. They're generally filled with sugar is often one of the first things listed, so a primary ingredient,
Mhm.
and yeah, preservatives, additives. So think about those foods that come in a box that just have a lot of ingredients. Label reading will become your best friend.
That's good to learn. I think a lot of times, especially with the pandemic, hopefully coming to an end soon, and some of us start to put on real clothes and like, oh, this is not fitting the way it was before.
Right.
Um, I think that especially with the gyms just opening up now, I can test myself about that. It's good to have from you just kind of understanding of kind of if you're going to think about something like this, how you do it in an appropriate and knowledgeable way. So thanks for sharing that, especially for something like this that seems a little bit more restrictive. And I think sometimes people may embrace the restrictiveness of this, but it's good to
Mhm.
know that what you can and can't do for this. But I think there's probably going to be an uptick in a lot of retail buying for new clothes, whether people are bored of what they have or they don't fit in what they had before, and also really buying new more foods to get
Mhm.
on some diet. So this is good to know. Let's get into the next one here. So ketogenic or AKA
Mhm.
keto. And so this is something that, I remember, many, many years ago, like it was the fad. People were about to get married. They go on the keto to lose weight really quickly for their wedding pictures, and I think that, obviously we know that the body can have different sources of fuel. Typically, it's usually carbohydrates, but sometimes it can use fat. So to undergo ketosis. So
Yep.
Jen, can you walk us through this diet and give us the pros and cons and certain pearls about this, and also who should and should not do this one?
Yeah, yeah. So, yeah, keto has become super popular. I mean, I think the precursor to keto was like the Atkins diet,
Yes,
I
Atkins
think,
diet. Yeah.
right?
Hmm.
So the thing with keto is, it's these low fat, high carb meals with moderate protein.
Hmm.
And to your point, what happens is this, or I'm sorry, the other way around, high fat, low carb, the reduction in carbs puts your body into this state, to your point, ketosis. And so burning fat. So for some people, you can get really quick wins with late weight loss with
Hmm.
something like this because it's burning fat. It can also help regulate blood sugar and insulin levels. It's definitely not for everyone, and it's generally not a long term way of eating. I've talked to a couple of doctors about it. I actually know some fertility doctors who kind of prescribe keto for
Oh.
their clients, for their patients who
Hmm.
um, need to lose a lot of weight so they
Hmm.
can get those quick wins and sort of drop the pounds quickly. But
Yeah.
again, it's just generally not that sustainable.
Hmm.
It generally means that reduction in carbs means fewer veggies, which
Hmm.
means less nutrition.
Hmm.
And also, to our point earlier, plant based protein is generally better for you than animal based protein when you're trying to conceive. And this diet is very meat heavy.
Yeah.
So for some PCOS patients, again, it can sort of in an early stage seem to be helpful, but long term, it doesn't seem sustainable.
Yeah, I mean, I see this a lot when, we have patients who come in and, obviously I'm extremely sensitive about talking about weight because obviously you never want someone to feel badly about anything about themselves, but also we try and optimize their health and optimize their success. And many of them jump to this as an option, but you're right. You really do get some quick wins. Your body probably quickly does react to this, but then the issue is, and I was bringing up, is like, how do you sustain this
Mhm.
during this phase after you get to your weight goal? And then when you do some of the fertility hormones, you can have an increased weight gain because of just fluid retention. And then this vicious cycle happens, and then you conceive, then you go off the keto, and then you rebound again. And so, yeah, I think one thing I always make clear is that this is a life decision for weight loss of those who have to lose weight
Right.
prior to conceiving. And it's not just getting pregnant, it's also maintaining a healthy pregnancy. And there's a lot of studies looking at, again, increased risk for stillbirth, increased risk for C-sections, increased risk for preeclampsia, and increased risk of shoulder dystocia, where the baby's shoulders get stuck during delivery. We have to have an emergency C-section. And so I think, as you point out, it's really important to look at the long-term goal, not just like the short-term win. And I think, this is something, if you have, obviously you have to fit into some type of whatever for a photo shoot or some type of wedding or something, yes. But I think long term for many of our patients, I really don't advise this because I don't think it's a lifelong habit or the diet pattern that you can sustain, for many, many years without having some type of nutritional adverse effects.
Yeah, yeah, I really agree with you. And when you think about sort of that long-term sustainability and even getting some of those quick wins, if you think back to what we talked about with the Mediterranean diet, if you are eating a lot of whole foods in the forms of vegetables and fruits and these really, nutritious foods that are going to fill you up, like those types
Mhm.
of foods are really filling too. You can get some wins from that early on too, and it's a much more sustainable way of eating. And I like to say that, if you think about eating all those things, you're naturally going to start to crowd out the things that don't serve you.
Yeah.
So yeah, definitely a Mediterranean style diet is much more suitable long term. It's definitely a lifestyle change.
It is. One of my great friends who's really knowledgeable about that, he's been doing this for several years and he's had a great result. He's been able to maintain it. And we'll go out to eat for lunch and I'll see him have like all this bacon and things I would never eat. And but one piece of bread comes his way, he's like, it's like kryptonite, you know? So it's very interesting. Tell me in this diet, what would be the preferred fat that you would eat if you were on a keto diet?
The keto diet, I mean, it's very meat heavy.
Yeah,
So, animal protein.
it's animal protein mainly. Okay.
Yeah, and so that's why, I say that you're not getting a lot of vegetables with it. So that reduction in carbs is, really going to impact the amount of veggies that you get.
You also worry too in those who may have a cardiac family history that that would also increase their risk for atherosclerosis and
Mhm.
hyperlipidemias that would affect their overall cardiac health, not just now but in the future. So that's important for people to think about if they're trying to do this long term. So thanks
Yeah,
for that summary for this one as well. But that's important to think
sure,
about.
sure.
The next one's going to be vegan. This is probably fairly simple, but there's so many different types of vegan when I was looking at this. Can you just walk us through, the basics of vegan and then kind of what you see as the kind of primary subtypes of vegan that, may be appropriate in folks who are trying to conceive?
Yeah, yeah. So the thing about vegan is, to your slide, no animal products. So that's meat, eggs, dairy, any animal byproducts. Generally people who are vegan are opposed to eating meat for either ethical or environmental reasons or both. Um, sort of a step away from vegan is vegetarian, where you might eat eggs. Um, you might eat dairy. There's pescatarian, where you eat only fish. So there are sort of variations, but vegan itself is, absolutely no animal products. Um, I think that when you talk about vegan or even vegetarian, our bodies need to change and evolve at different
Mhm,
points in your life, right?
mhm, mhm.
I was vegetarian for like 20 years.
Oh, wow, I didn't know that. Okay.
Yeah, yeah. And then I got to a point where I just started paying attention to what my body was telling me, and
Yeah.
I realized that I wanted to add some animal products into my diet. So I started eating chicken.
Hmm.
So it's really important to pay attention to what your body's telling you. I think the biggest hurdle for clients who are vegan is making sure that you're getting a balanced diet and
Yeah.
enough nutrients, particularly protein.
Mhm.
So a vegan diet definitely requires a lot of meal planning and preparation.
Okay, that's good to know.
Um, I would say definitely talk to your doctor, your primary care physician, or your healthcare provider about supplements if you're vegan, including B12 and iron.
Mhm.
Um, Vegan diets can often be lacking in those two. Um, Good sources of protein are beans, nuts, seeds, legumes, and
Mhm.
whole grains. Sometimes what I've seen from my clients who are vegan is they tend to get a lot of empty calories because they're
Yeah.
grabbing things that are sort of easy. If you have a busy schedule, and you can't do a lot of that food prep and menu planning or meal planning, it can be difficult to adhere to without relying on, some grab and go products.
Well, that's good to hear. I mean, I think that the meal prep is something, that many of us are busy or we're moving back and forth. And just if when people start to become more mobile and going back to work, even during the day for your lunch or breakfast, just thinking about what you should be eating. And the biggest thing my concern is always, how do you supplement things? So can you get a sense of kind of what the main supplements you think vegan participants will typically need to be taking? if they're going to be stick with this diet?
Yeah, so my understanding is you really need to keep a good eye on how much protein you're eating and make sure
Hmm.
that you're getting adequate protein. B12, iron is another one.
Yep.
Citrus can actually help bring out the iron. I'm probably not
Oh,
saying that the right way, but like bring out the iron in
yeah,
vegetables. So
yeah,
for example, if you like did a squeeze of lemon on your spinach
yeah.
or had a little bit of orange juice with a meal, something like that, that can be helpful.
That's
And then there is, I think it's choline and eggs that
mhm.
you might want to supplement with that too if you're not eating eggs, but you can check with your healthcare provider about
It's good to know. Thank you for that.
that.
And then finally, different than the diets is just eating patterns. This is the one
Mhm.
unique part about this webinar presentation I want to talk about a little bit more. Intermittent fasting's been become extremely popular over the past, I think 2 to 3 years, for a couple of reasons. I think that we think about is going back to the whole paleo principles of thinking about how we have evolved, where we really had to work to get our food. We couldn't go to a supermarket or to a corner store to get food, so we won't go without food for extended periods of time. And during our evolution, and you go between eating and fasting, there's several high level studies that have been shown some benefits to this. Can you walk us through this, Jennifer, in terms of practice and principles, and what you see in your clientele who come to see you who may be doing this?
Yeah, yeah, definitely. So it's definitely gained popularity. It's interesting. If you think about it, fasting has been around in,
Mhm.
like cultural or religious or spiritual traditions for like thousands of years,
Yeah.
right? It's interesting. It's got a long history. But basically, what intermittent fasting does is it gives your digestive system kind of a longer rest in a 24-hour period. So, say 12, 14, up to 16 hours a night. And to your point, it's about food timing.
Hmm.
So, you're going to take this break, say, from, let's say, the way you're intermittent fasting, you take a break you don't eat from 8 p.m. and say you don't eat again until 10 a.m. or noon. Um, and then in between meals, you have unsweetened clear liquids. So the reason is to get your body into this rest and digest period,
Hmm.
to give your digestive system a break and to allow your parasympathetic nervous system to kick in. Um, Generally people who do intermittent fasting tend to be leaner, and it seems to promote a number of health benefits. You have some of them listed there, but also reduced inflammation.
Hmm. Hmm.
It can help with blood sugar balance and lower insulin levels. And it can definitely be helpful if you want to lose weight prior to trying to get pregnant. I think one of the biggest things that I'm careful about in my practice is that it's not good for people who have experienced any sort of eating disorder, because
Got
that calorie restriction can be a real trigger.
it. Hmm.
So I think it's so important to be cautious of that. Most of what we know about intermittent fasting and fertility um, is based primarily on how our hormones in our bodies function under periods of stress.
Yeah.
And so, to your point, there are a lot of different approaches. Some people will do intermittent fasting 1 or 2 days a week. Some people will do it on the weekends. Some people will do, say, 12 hours, working up to 14 or 16
Hmm.
hours of fasting. I think one of the important things for women, particularly women who are trying to conceive, is to keep an eye on your menstrual cycle and
Yes.
to see if your cycle is responding to the fasting. Because for some people, it can put us a little bit in that fight or flight mode, which can impact your cycle and ultimately impact your fertility. So it
That's
can be
next.
done, and it has been done successfully for women who are trying to conceive. But going back to one of your very first points is like really listen to your body, pay attention to your
Yeah.
cycle.
That's an excellent point, Jennifer. I know that in my practice, I do see a fair amount of women who are athletes or those who may have eating disorders that maybe not be disclosed. And so you're right, this is something to be very careful. And there's when folks already have a history of challenges with food, but also the female neurosystem is extremely sensitive to caloric intake and to lean body mass.
Mhm.
And with the different interactions that happen in the pituitary gland, it definitely can affect the hormones FSH and LH being secreted in a off pattern way, where it can definitely affect menstrual regularities. Typically, as you point the fight or flight, those in the audience may know that when you restrict calories, many times your cortisol levels will rise.
Mhm.
And when cortisol levels rise, that also causes a reflex of levels in your pituitary gland, which is in your brain, to increase as well, which can then reduce the amount of signals that your brain sends off to your ovaries to ovulate and release an egg every month. So I think there definitely is a very more narrow window in reproductive age women that you have to look out for this eating pattern, just because we wouldn't want to ultimately try to lose weight, but then cause another problem, which would be affecting ovulatory status or the ability to ovulate. So those are really great points here, Jennifer, especially with the female physiology, to make sure we're not causing another issue by trying to solve another one.
Right, right. Yeah, yeah.
Another thing we see too, and I have done, this looking at mouse models, is there are several mouse models of caloric restriction, and you will see a improved rate of cell repair. And so a lot of women who may have concerns about their ovarian reserve or their lining of the uterus or endometrium, which is what it's called, sometimes this may possibly optimize those, but it's hard to know really in the human model what it does. But there are definitely, as you pointed out, a long history of fasting. I know many of my patients recently who follow Islam and Ramadan is
Mhm.
one prime example recently that we've had. But many other religions and many other kind of sects definitely do employ fasting. I think it's not a bad thing to not be eating continuously to really optimize your body health. Let's go into your next slide here. So you talked about this before, but I kind of want you to really walk us through just, and one thing that struck me is really, what are the most ideal plant proteins that we could consume?
Yep. So, really good sources of plant proteins are beans. Um, so that would be like black beans, kidney
Mhm.
beans, those sort of things. Chickpeas, which are technically a legume. Nuts. So, almonds, walnuts are a great one. And nut butters, like almond
Mhm.
butter, things like that. Seeds. So sesame seeds, pumpkin seeds, legumes like lentils and peas. And then whole grains are also a good protein source, plant-based. So like think about quinoa. That's another really good one. Um, if you do eat animal protein, kind of the hierarchy would be wild caught fish,
Mhm.
um, pasture raised organic chicken, and not a lot of red meat.
Gotcha. That's great. That's great. So this has been great. I think over the next 10 minutes, I just want to kind of summarize points for the audience. I think the first thing is, I see those who came later, just summarize first off just general nutrition principles for the audience so they can take away kind of what they should be thinking about when looking at their own nutrition.
Yeah, yeah, definitely. So I think the first one that we talked about was really that individualized approach and
Mhm.
listening to your body and knowing what works for you and what doesn't work for you. Food is information. I don't like to think about food as good or bad. I think about it as information.
Mhm.
So eat the rainbow is one of my mantras, a wide variety of colors in your fruits and vegetables. Choosing organic where possible to lower your toxic load from pesticides, which has definitely been shown to be an issue with pregnancy and even IVF. And then for many, many, many women, eating gluten-free grains and carbs. Um, And as we talked about, if I had to really endorse one way of eating for fertility, it would be that Mediterranean style diet.
Gotcha. That's great. And then thinking about what factors help you select your diet choices. We talked about, inflammation is something we really want to eliminate. Also, you know, if you're trying for weight loss versus other lifestyle issues, just tell me kind of basically how someone should think about if they want to select a diet, what they should be selecting, not selecting.
Yeah, so I think like what you just said, think about what your goals are, right?
Mhm,
Is your goal to improve egg quality? Is your
mhm.
goal to lose weight? Is your goal to just have a healthier lifestyle that you can maintain for months and years going forward? Um, and then really taking that individualized approach and learning, how is your body responding to certain foods? How does it make you feel when you eat certain foods? A lot of my clients, when we first start working together, I'll have them fill out a food journal for a few days
Okay,
that not
great.
only talks about what they eat, but how the food makes them feel,
Yeah,
just to get a sense of that. Taking things out of your diet that don't work for you, but importantly, adding things in. So it's not just about like elimination, taking things away, but it's really adding these fertility boosting, health giving foods.
that's perfect. That's perfect. And then suggestions for long-term sustainability. I'm sure you see somebody who comes and they want to change a lot of things about themselves. They're not in a good place. You get them into a good place. What's your advice for being consistent, resilient, and sustaining your diet and your progress?
Yeah, yeah, that's such a good question because that's it, right? You don't want to be, sort of tunnel vision, like I'm going to do this for this period of time,
Hmm.
because if the goal is to get pregnant, then you want to have a healthy pregnancy, you want to have a healthy baby, and you want to be a healthy mom.
Hmm.
So, um, really, the best practice is practicing what I call the 80-20 rule.
Hmm.
Perfection is never the goal.
Hmm.
Perfection is going to set you up for failure. My
Yeah.
clients hear me say this over and over again. So it's that 80-20 rule. Unless you really have a true issue with something, like unless you're sensitive to gluten, you know, sugar or dairy, good for you? No. Inflammatory, not the best.
Right.
But at least if you're going to have that bowl of ice cream, really enjoy it and then move on, you
Yeah.
know?
That's good. I think people always feel guilty about cheating, and then it's all of a sudden it's like, oh, okay, I can't do this, and they don't continue it. And I think that you're right. No one is perfect.
Right.
You can't always be on point when you're exercising or working out. As
Hmm.
long as the average is 80-20, it makes complete sense to pep. As long as you're above the average and you keep going and you build momentum, sometimes you may have bad days, but if
Yes,
you have more good days than bad days, that's the most important things. That's good. That's what I
absolutely.
love this.
Yeah,
And
absolutely.
then finally, let me get into a couple other things here with the slides here. Let me get into this last bit here. So one thing I want to mention for those who are here, and something that's really exciting, is a collaboration with Jennifer and colleagues with Fertility Foundations, really a mind and body practice to boost fertility. And so, Jen, I want you to kind of, if you can, walk through this for us. I have a face sheet here of what it is.
Yeah.
Looks like it's beginning June 8th, and give us a sense of what it's going to entail. We're really excited to kind of hear more about this and really have our patients, our mutual patients, really participate in this and really get the most out of it.
Yeah, yeah. Oh my gosh, Dr. Styer, I'm so excited about this
Yeah.
program. So it's a 5-week group program. It begins June 8th. And like you said, it's mind and body practices to boost fertility. Um, it's going to be a small group of women. Every week, we're going to have a live training like this with a
Hmm.
Q&A. We're going to have a live group meditation. There's going to be a live yoga practice. That's all going to happen within that 90 minutes that we meet together every week. And then in between sessions, there's going to be access to CCRM physicians for questions and advice. We're going to have a private member portal where we can connect between our live sessions to ask questions, get support, and just provide resources. Topics are going to include diet and nutrition, stress management, kind of living a greener lifestyle, boosting fertility and egg quality, stress management and mindfulness. I'm co-running it with Carrie Hines, who is this amazing fertility yoga practitioner. And
I can
really,
attest to that. Myself and Allison Ziman did a session like a year or two ago. We did it here in our lobby, and she's phenomenal. So I think
yeah,
anybody who's hearing me say this now, I'm not somebody who's ever really done yoga, nor do I know much about yoga.
uh,
When I went home and I said, wow, like, how have I missed doing this my entire life? It was a really extremely relaxing and
yeah,
just therapeutic and cathartic session. So I feel like you guys are going to be the dynamic duo here when it comes to nutrition and yoga and wellness, really to really help our patients optimize anything. But I got to tell you, this sounds like an incredible program that you guys have put together. I'm super proud to see this all come to fruition, and I'm happy. I'm looking forward to seeing how the patients and everybody will benefit from this.
yeah, yeah. You know, I really feel like it's the, so I will say in full disclosure, Carrie and I both went through infertility, and I feel like it's the program we wish we had when we were going through infertility treatment. And really, you know, it's for anybody who really wants that extra level of support in their journey, you know, kind of from all angles, right? Like yoga, lifestyle, diet, access to amazing doctors at CCRM. You know, it's just going to be a super supportive, informative container. So I'm just really thrilled that we're launching it.
So tell me, if I'm a patient who's seeing this now or whenever, how do I sign up for this? What's the process?
Yep. So there is complete information and sign up on my website.
Okay.
My website is jenredmond.com. So JENN, two N's, REDMOND.com/foundations.
Okay.
And so all the information is there.
Okay, great.
Yeah, and if people have questions, you know, I'm available. Carrie's available to answer them.
That's excellent. Well, that's great. Well, thanks again, Jennifer, for another, great hour just talking about just how we can help patients help themselves with looking at other approaches for nutrition and optimizing wellness. It's always a pleasure to work with you, whether it be here at Resolve New England, really trying to get the best out of everyone and really get the best out of care for patients here in New England. So thanks so much for really sharing your expertise and, as always, being such a great collaborator and partner in care with our patients. So we all really appreciate here at CCRM.
Oh, well, thank you so much. It's absolutely my pleasure. And it's such an honor to work with you and with a practitioner who really understands and supports, you know, sort of holistic health during this journey. I think it's your patients are really lucky to have you. And I mean that with all my heart. So it's just really a pleasure to do these events with you. So thank you so much.
Thank you, Jennifer. Thanks so much. Thank you. So I think we're going to try to take some questions. I think Heather or Jennifer, or other questions that we have here that we can answer for the crowd.
Hi, it's Heather. So one of the questions is for Jennifer. It is, your program sounds wonderful. Just wondering if there's going to be opportunities during the program to talk to you about specifics, specific journeys, diets, and digestive health.
Yeah, absolutely. So everybody who enters the program is going to fill out a quick intake form. And then there'll be opportunities in our portal. There's going to be, I'm calling it a message board. That's not the right name, but it's a place for us. It's kind of like a Facebook group, but it's not on Facebook. It's in a private portal where we're going to be able to connect. And then you'll also have the opportunity to have a one-on-one with Carrie or me, or both.
Awesome. All right, this one's a little bit. Do you find, and I may say this wrong, so I apologize, Seriaphytus to be helpful for fertility? It's spelled S as in Sam, ERRAPEPTASE. Are you familiar with that?
I'm not familiar with that. Dr. Styer, do you know?
I'm not either. Can you ask, can the person say where they got this from, or where they've seen this? And we can definitely look it up and see.
Yeah.
If we don't know the answer now, so I'm happy to do that.
I was actually just going to Google it.
Yeah. Let me see here.
And then another question is, what if you need to gain weight and eat and eat healthy. Do you recommend the Mediterranean diet for that?
Yeah, I think that, it's a really good balanced diet, and particularly because the fats that you're going to be eating on a Mediterranean diet are healthy fats. So it's things like avocado, olive oil, nuts and seeds, all really healthy forms of fat. So yeah, I think that's a great idea.
Yeah, that's what I definitely do recommend. I know it sounds strange to say you have to gain weight if you're trying to lose weight, but I have some patients who body mass index is below 19, and we see they don't have menses, or they have very light menses, or their lining of the uterus doesn't get thick enough. And so these are all factors that affect implantation or
Yeah.
success or response. So, and I think, and like even with weight loss, weight gain in a gradual fashion is important. I think also too, you want to make sure that you don't change your body morphology too quickly either, because you want to make sure that, you're not, doing something that will adversely impact your health. But I think I've always used that as a way to gain weight as well with between Mediterranean diet, because it does have, a lot of long-term data that show benefits, but also I think it's the best way to gain weight without doing things like cutting corners and eating things that are not good for you. So I agree with Jennifer.
Yeah, and I think that's such a good point, Dr. Styer, about just like when you do weight loss, it's healthier in the long term, in the long run, to do a gradual weight loss, to do a gradual weight gain as well.
Mm-hmm.
She's texting me or messaging me back. It's a supplement found on Amazon. So I'm Googling it right now.
I'm sorry, can you spell it again?
It's SERRAPEPTASA. It's an enzyme.
Not familiar with that.
Proteolytic enzyme and a bacteria.
So we can do, if I can, I'll get that information for Heather. I can get back to her, just get her information.
Okay.
I'll get back to her with the information. I'd like to look at it a little bit more, that's on Amazon, but see if there's any studies on PubMed that looks at this. So I'm happy to do that legwork, look for her. So just get her information, we can get back to her, okay?
Awesome, I'll do that. Another question, do these recommendations also apply to men to help with their fertility, or do you have any specific recommendations for men?
Yeah,
Okay.
so I mean, Dr. Styer made a really good point when we got started that, males it's half the equation, and we often think about the female when we talk about fertility, but there are definitely things that men can do as well. I think there are antioxidants, which are I know, Dr. Styer, you prescribe often acai for your female patients, but antioxidants can be really helpful for men as well. Reducing alcohol consumption, limiting sugar and red meat can be helpful. Things like that. So there are definitely things that the male partner can do to help. Is there anything you recommend, Dr.
No,
Styer?
I agree. I mean, I see the same thing. I think that an optimal exercise program and body mass index is important. We see at baseline lower sperm parameters than ever before. And I think it probably has to do with, as we pointed out, pesticides and other kind of things, and plastics that probably do affect it in environmental exposures. We do see that male weight can also, that's higher weight typically, impact sperm parameters. And I typically think about antioxidants in men, such as, the coenzyme Q10 is one that I prescribe fairly regularly to men who have potential sperm issues. Also, things like zinc and selenium are also important factors, cofactors as well. But I think we always forget about the male side, and like everything else is so inequitable. We always put things on the female side, and we have to step back for a second and think there's both egg and sperm that go into getting pregnant. And so I think that you really have to optimize both sides. And I think that although sperm and sometimes, male sides are a little more simplistic than female side of things, you definitely want to optimize production of sperm. Remember, a man makes a new cohort of sperm every 61 to 72 days. In a similar fashion as to when you see a follicle on an ultrasound, that won't be ovulated for the next 3 months. The same thing with men in terms of there's different waves. And so if you can optimize nutrition, the following wave a couple months later for either an IVF cycle, or if you're trying to conceive, may be better from a male standpoint. So I think definitely all things are equal here when it comes to dietary impact, and also men looking at the same principles as women do when they're trying to conceive with a partner.
Awesome. So here's another question. My acupuncturist encouraged eating warming foods versus cold foods like salad. Is this something you recommend?
Yes, actually. For many women, foods that have been foods that are warmed and are warming, so also warming spices like turmeric and ginger, but then also foods that are lightly cooked really can help promote better digestion. And so yeah, I often recommend that women eat foods that are lightly cooked as opposed to raw.
Also, is there certain forms of exercise that you would recommend over others?
Yeah, so I really do think that aerobic exercise is really the primary one that, and weight bearing as well. But we think about swimming, it's probably probably one of the best ones that you can do. It's a great anaerobic and aerobic exercise using all body parts. That's the first one. The second one is going to be obviously, treadmill, walking. Running is also ideal depending if your joints can handle it. But I think that, other things like elliptical and spinning are also great things as long as you hydrate appropriately. And I think the most important thing is it doesn't matter about what type of exercise as long as you're doing something. It depends upon who you are. I think the biggest point too is recovery. I think those who are trying to lose weight or those who are trying to build muscle don't realize that your muscle is actually not built or doesn't grow during the actual weightlifting or exercise. It's actually 24 to 48 hours afterwards when the amino acids in your system come to the muscles and basically repair the muscles. Remember, when you're working out, you're damaging the muscles continuously. The repair really does dictate the growth of muscle and dictates what type of lean muscle mass you have. So I say that for me, primarily aerobic exercise, swimming, walking, running, elliptical, biking, but also with weight-bearing exercises, whether it be weightlifting, Pilates, all these different things are great in with balance. I say your body does need about 1 to 2 days off per week at least. I think a lot of patients may want to do it every day, and I think sometimes your body needs a little bit of a break because it really has to do a couple things, including repair itself and also optimize its function. One other thing to think about too is it's important too is sleep. Sleep is probably one of the most important things we all overlook. None of us get enough sleep. And you'll have studies that look at 7 hours, 8 hours. I typically say 7 to 8 hours if possible. I know it may be difficult for some people, but we have to sleep for a reason. We have to sleep for the fact that we need, again, body repair. Also, human growth hormone, which is a major metabolic substance released in the body, which really does impact longevity, is released at more optimal levels when we get appropriate amount of sleep. So I think exercise, aerobic exercise, well, weightlifting and sleep is my kind of triumvirate of things I really recommend to optimize health and wellness.
Cool. All right. Is there a specific C supplement that you recommend?
That's a difficult one because remember that with any supplement, there's not regulation of what's in it. So the potency can be all over the place. It could be like pretty much none of that supplement or too much. I know that just kind of plugging the CCRM trial that was done recently, which showed a benefit with OSCE over the course of 2 to 3 months for IVF outcomes. There is a supplement that we prescribe our patients that's through a pharmacy where it's a particular powder that goes into a drink it was used in the study. It's a study grade a supplement that we recommend here. But besides that, I can't really think of any real great acai supplements that are out there that we know have potency that would sustain antioxidation in the long term.
Okay. Any additional tips specifically for women with low ovarian reserve?
Yeah, I mean, I think, this is a really difficult situation because, as I pointed out before, we start with a certain number and it declines. I think a couple things here is I think number one, this is not even medical, it's more of an emotional and supportive thing, is that there's going to be a certain number of women who have a higher egg reserve, average, and low egg reserve. I wish I was 6'5". I'm never going to be that. Okay. The same thing with eye color or someone's weight or someone's intelligence, always different variations. So the first thing when someone comes to see me is I say to them, okay, we know we have in front of us, we have numbers that show we have reduced egg reserve by numbers. This is no commentary on what you've done now or in your prior years from now. You did nothing to cause this. It's good that we've identified it. And I think in terms of that, it's just first of all normalizing that this is a common diagnosis. That's the first thing I do when somebody has low egg reserve. Now, from a medical standpoint, we think about what can we do to hopefully optimize. So I think about coenzyme Q10, 600 milligrams per day, vitamin D3, 2,000 IUs, international units per day, omega-3 fatty acids, 2,000 IUs per milligrams per day. That's because it's anti-inflammatory, and then a prenatal vitamin. And then finally, thinking about, okay, what are the options? And that goes more to consultation. Also, I want to say that the numbers that we see, whether it be someone's AMH or anti-Müllerian hormone, which is one of the more common ones, or day 3 FSH and estradiol, none of these things have ever proven to predict fertility or pregnancy, meaning that those people can have really great numbers and not get pregnant, and those who can have lower numbers may get pregnant. Great study that was published about 2017, North Carolina, which showed that in a population of differing AMHs, there was no way to predict pregnancy. So I think the first thing is to normalize what it is. The second thing is to talk with your physician about, okay, what are strategies that they can do to optimize your egg number and egg quality. And the third thing is to realize that, people really get anxious about the fact, okay, I see I have reduced egg reserve. My clock's ticking. Tomorrow I'm going to have 10 or 15 or 50 less eggs. Remember that the body doesn't work that way. Things are gradual and decline. So those who are listening now, I want you to understand that this is a very common thing. And these are things we as fertility doctors see very commonly. And I want you to know that there's, you don't have to act tomorrow, but you want to be expeditious in what you do. And to find somebody that can explain these things to you in a way that makes sense. And also realize that you're not just a number. There's a lot of things that go into fertility besides an AMH and FSH. Also, there can be a male factor. Also, there could be the stimulation protocol you do. It could be the laboratory where you're in. There's a lot of things that you can utilize to still have a good outcome with reduced egg reserve. Some folks may have 20 eggs and only have one good embryo. Some folks can have 5 eggs and have 2 good embryos. It only takes one good embryo to get pregnant. So I think that's the one thing I would say here as someone with diminished egg reserve is the kind of emotional, mental side, the medical side of knowing that there's not a great correlation between the number and kind of where you are. The interventions you can do, which is going to be optimized wellness and diet and health with supplements and Jennifer's advice, even seeing someone like Jennifer, she does a great thing. It's like this fertility purge that a lot of patients have done where they've really gotten rid of a lot of things that have really not been healthy for them. And I think finally, it's going to be sitting down with your fertility team to think about what's the best strategy for your care in the future. So that's my approach to administrative egg reserve that I've used over the course of my career. And I've refined it as I've learned more from patients and seen more cases of this. But I think it's not just one silver bullet. It's a lot of different things to really help you emotionally, medically, and in dietary wise to hopefully succeed in the future.
Awesome. Okay, we have a couple more questions. Are core exercises okay?
They're fine.
Yeah, and she had said it looks like she has heard in the past that expand exercises are fine, but not contracting exercises.
Right.
Is one better versus the other?
Hey, Jennifer, what do you think?
Yeah, so that's definitely something I talk with my clients about, I think, and you'll hear that a lot in Chinese medicine too, to do exercises that are more opening and expanding instead of exercises that are contracting. I mean, a lot of exercise too, you really want to think about where you are in your cycle too, particularly if you're going through a treatment cycle. But yeah, if you want to think about those exercises that are more expansive and more opening, that's why fertility yoga or yoga is can be such an important part of a workout plan when you're trying to conceive.
Okay. And do you guys recommend any Q10 supplements for egg quality?
So the coenzyme Q10 is what I recommend. CoQ10. It's also called ubiquinol sometimes, but 600 milligrams per day is what I recommend. And again, I try to give people, start them a couple of weeks or months before they start something. I think also acupuncture is extremely important. We've done several webinars about that. I'm a really big fan of this, although I learned nothing about acupuncture in medical school, residency or fellowship. I have to say to you, I've seen some of my toughest cases I've worked with, have my acupuncture colleagues as well as Jennifer. It takes a tribe to help somebody get through sometimes, and I think it definitely is another aspect to think about when you're looking at this from a holistic standpoint.
And how much of the mg would you use of that CoQ10?
600 milligrams per day.
600? Okay. And then we have one more question. It says, why is it that I had low AMH and then a year later it went up over normal? Does that have to do anything with acupuncture? It looks like she may be been doing that.
Yeah, so a couple of things come up here is that, remember, it depends upon where, if it's done in the same place. Remember that AMH levels can differ depending upon what lab you do. If it's done in, like, say, here versus another hospital, it could be different because the assays are different, number one. And number two, sometimes the assays may not be accurate depending upon the day or the month. There could be some variations. They shouldn't go up dramatically, shouldn't double, but it definitely can be different by 20 or 30%, sometimes 40%. I think the other thing that comes up is sometimes if you have any kind of, underlying, illness, or you may have been on birth control pills for a period of time or some other suppressive therapies, they can also change it. Also, we know that obesity can also affect levels too in some cases. So that's some of my explanations. But usually it shouldn't change where it is doubled or tripled. It may go up about 20 or 30, maybe 40% at most, but we see some fluctuations. Not every lab test is perfect, so there can be variation because there's human error when they, when they do the processing of this as well.
Okay. And then I have another question. Omega-3 and vitamin D, how much mg would you recommend daily?
Your omega-3 is about 1,000, 2,000 milligrams per day of that, and try to get like the gel caps.
Okay.
They call them no fish burps, so that it doesn't taste badly when you do. I actually do them. I've been doing it for 10 years. I love them, but like these like these yellow gel caps are great. Then vitamin D3, I'll say that there's a very high instance of vitamin D deficiency because everybody's been inside for the past year and a half. So definitely do about 2,000 IUs, international units per day of vitamin D. Here at CCRM, we check everyone's vitamin D as a point of just routine care, like we do thyroid testing, because it's so easily replaced and such an easy thing to change. And we know that vitamin D is very important, especially metabolism during pregnancy. So we definitely do want to make sure we supplement people here if they have a low vitamin D with it here with one of our protocols.
Okay. Looks like that is all of the questions.
Well, great. Well, again, this has been a great time, and really thank you so much, Heather, for pinch hitting for Jennifer Raymond. Jennifer, if you're out there, thank you so much for organizing this for us. You did an incredible job as usual organizing. Jennifer Raymond, again, I love working with you. Do something like this again, hopefully in 6 months or so. And everyone out there, please reach out to us if you need anything. And again, Fertility Foundations, looking forward to it June 8th. This is going to be incredible. So we'll post it, but congrats to you and Carrie for organizing that. I'm looking forward to the success that it will bring for you, but also for the patients who enroll in the program.
Yeah, thank you so much. This has been great and really good questions. It's been fun.
Great. It's great.
Yeah.
Everyone, have a great evening. Thanks so much for tuning in. Have a great night. Bye-bye.
Thank you. Bye.